Well, you're most welcome to today's talk. It's the end of May 2022. Now, of course, on this channel, we like to promote health as much as we can, give information to allow people to make informed decisions to prevent disease, delay disease, and optimize health generally. And we're going to look at a study today, and this shows that regular supplements of vitamin D, relatively small regular supplements of vitamin D, reduce the likelihood of developing autoimmune disease by 22%. And this is not an observational study, it's a prospective interventional study where people were actually compared who were actually given the vitamin D against placebo group. So it's an interventional study. So that's what this is about. We'll be looking at evidence related to this, and we'll look at some other information around about autoimmune disease. But if you don't want to watch, the bottom line is over the age of 50, and probably earlier, we don't know, but over the age of 50, giving relatively small amounts of vitamin D on a daily basis, according to this data, reduces the likelihood of developing autoimmune disease and probably other diseases as well. But this paper is just about autoimmune disease. So let's dive straight into that if you want to stick around. Background here, vitamin D regulates a wide array of genes involved in inflammation and immunity. So in autoimmune diseases, we get too much inflammation caused by abnormal immunity. And basically, autoimmune disease is where the body's immune system attacks its own tissues. It's a friendly fire disease in military terms. The body's immune system is attacking itself. Really bad idea, but that's the nature of pathology. Of course, it is a bad idea. Now, inconsistently associated with the reduced risk in several autoimmune diseases in observational studies. So some observational studies have said, well, yeah, vitamin D is helpful. Other observational studies have said, well, no, actually, there's not much difference. And that's why this study is important, because it's a much higher quality interventional study. They're actually given the vitamin D to compare it. Active form of vitamin D regulates genes, basically turns genes on and off. This is what we call epigenetics now, influencing inflammation and acquired and innate immunity. This is both branches of the immune system. So acquired immunity, that's the specific type of immunity, and innate immunity, that's the non-specific type of immunity. Both need vitamin D. And this study is also looking at the omega-3 fish oils. Dietary marine-derived long-chain omega-3 fatty acids, basically fish oils, decrease systemic inflammation in some autoimmune diseases. So giving these to people that already have autoimmune diseases can be beneficial. Does that mean they'll help to prevent it? Well, we don't know that, and that's what this study is about. To give you a bit of anticipation on that, we don't have evidence for this, although there are suggestions that it might be true. Evidence is needed on whether omega-3 fatty acids lower the risk of developing autoimmune disease. That's what we don't know, so that's why we're doing this study. Now, fish oils are interesting, and of course you can get fish oils from vegetarian sources as well, from different seaweeds and marine phytoplankton. If you can get that, sometimes you can buy it as a green powder, because a lot of people don't realise this, but people talk about fish oils, but it's not the fish that makes the oils. The fish actually concentrate the oils from the marine plants and the phytoplankton that the fish eat. So what human beings need to do is start mass producing marine phytoplankton, so we don't have to destroy ecosystems by overfishing, which we are doing at the moment. We can actually cultivate this, cultivate the plant rather than the fish, which is what we need to do, and let's leave the fish to maintain ecosystems as far as possible. Anyway, this study here is, this is the title of the study. Now, it's vitamin D and marine omega-3 fatty acid supplementation. So this is giving supplements, autoimmune disease. And we'll look at a bit more about this vital trial in a minute, or in a few minutes. To investigate whether vitamin D and marine-derived long-chain omega-3 fatty acids reduce the risk of autoimmune disease is what the study is about. And it's nationwide, and it's from the United States, largely based in the Boston area. And it's randomised, and it's double-blind. The people don't know whether they're getting the vitamin D or not. The people giving it out and assessing the results don't know. And it's placebo-controlled. So this is the best form of trial. Prospective randomised double-blind controlled trial. The quality of data from this is way much better than observational studies. that we've had in the past. And as we say, the results are very positive and very encouraging. You know, this is one of the things, you know, we could spend lots of money on developing expensive pharmaceuticals, or we could use things that we already have, like the sunshine, or very cheap vitamin D supplement tablets, which are dirt cheap. We need to, okay, so we need clever drugs for some things, but for a lot of things, we just need to promote health. We need to optimize health. This is a whole philosophical approach to healthcare that we really, I feel, really does need to be promoted. It's not really being promoted. And as well as that, that means people all around the world can benefit, not just those of us who are rich enough to afford pharmaceuticals in advanced countries. We can promote health for everyone. It's egalitarian if it works. And of course, this is showing that it does work. We've suspected it for a long time, but here we have evidence. Now, this trial involves nearly 26,000 people. Good split between men and women, 12,786 men, just over 13,000 women. Now, people had to be 50 when they started the trial. Women were 55. But the average age was 67.1. So this is in the older age groups. Now, this trial only tells us what this trial tells us. But it tells us about the reduced incidence of autoimmune disease in this age group with vitamin D. And I think there's other evidence, not from this trial, but there's other evidence that shows that vitamin D in younger age groups helps to prevent the autoimmune diseases that occur in younger age groups. Because, for example, some autoimmune diseases like diabetes mellitus type 1 or multiple sclerosis are more likely to occur in younger people. And of course, they're both terribly debilitating diseases. But more on the specific diseases if you want to stick around. Now, 18,000 were described as this strange way they have of defining this in the Americas, non-Hispanic whites. I think that just means they were white. 5,106 were self-described as black and other racial groups. So we've got a good range of ages. It is looking at the older age groups, and we've got a good range of ethnicities and racial backgrounds. Now, what was actually done? The intervention was 2,000 international units of vitamin D a day. Now, that's actually not that much. It's just 50 micrograms. That's a relatively low dose of vitamin D, but it was given every day or was prescribed for every day. And again, a relatively low dose of omega-3 fatty acids, 1,000 milligrams, which of course is 1 gram. So relatively low doses of vitamin D, 2,000 units a day. Just bear in mind with vitamin D, if you go outside and if it takes you 2 hours to get sunburnt, in an hour you're going to make about 20,000 units if you've got a large surface area of body exposed to the sun. So relatively small dose of vitamin D. Participants self-reported all neuroautoimmune diseases, and they went up to 5.3 years, which is great. And they were all confirmed in the medical records. So self-reported and confirmed by medical records. So this is, again, pretty good quality stuff. This is how to do studies. This is good. The vitamin D arm, the treatment group who got the vitamin D, so they got the vitamin D, 123 developed an autoimmune disease. Placebo group, 155. And the difference there is hazard ratio 0.78, and the p-value there is 0.05. In other words, there were only 78% as likely to develop autoimmune disease. In other words, there was a 22% reduction in autoimmune diseases in people that were taking the vitamin D. Now, I think the reason that this works is because the population as a whole is low in vitamin D. So if everyone had been following advice we've been talking about, for example, on this channel for a long time, this might not have worked as well, because if people already have enough vitamin D, giving extra is probably not going to be effective. But this shows to me that the fact that this did work means that vitamin D deficiency is really quite widespread, which is unfortunate for many other diseases. But this only tells us what this one tells us about. So, and we notice that the p-value there is 0.05, which is significant. In other words, there's only a 5% chance that this result arose by chance. So basically, this gets a big red tick. This is case proved. This is evidence. This is what we were looking for. Vitamin D supplements is reducing the probability of autoimmune disease. Now, the omega-3 group, it did show a difference. 130 in the who had the omega-3, and the placebo 148, but the difference there wasn't significant. The difference in the numbers wasn't significant. So we can't say there's an effect there. And I'll just show you the graphics that are associated with this, because they're quite interesting. Now, this is the vitamin D one. These had vitamin D. So this is active treatment. In other words, this group here had vitamin D, and this group here didn't. Now, there were first year, second year, third year, you see, not a big difference. Pretty similar. But then as we get into later times, after 1, 2, 3 years, we start to see quite a lot more autoimmune disease in the placebo group who weren't protected by the vitamin D, and less autoimmune disease. And the difference, of course, between those lines is the size of the gap. And it looks like it's only getting bigger. So if this study was extended for 10 years, we'll probably see a bigger effect. So pretty conclusive graphics. Now, this is the one for the omega 3s, and that did show a difference between the two groups. I mean, there's certainly we certainly see a difference there, but it didn't reach significance. The gap there was not as big for the number of people in the study. P equals 0.19, which is not reaching the P equals 0.5 level of significance. But an interesting effect, and would be great if people could have more omega-3 fatty acids, as we say, from phytoplankton sources. So let's hope the food technologists get their act together and start growing up large amounts of marine phytoplankton, because that's where the fats come from the plants. This was the actual study itself here. If you want to look at it for yourself, the whole thing is there. You can download the PDF. And this is the clinicaltrials.org, which actually talks about it as well. And interesting here, we see that we have the National Cancer Institute, the National Heart and Lung and Blood Institute, the Office of Dietary Supplements, the National Institute of Neurological Disease and Stroke. So these are people that don't have any obvious financial interest in this. And this, of course, is the trouble with pharmaceuticals, because pharmaceutical industry is motivated to make molecules that it can make money out of, and vitamin D you can't, because it's out of patent. It's just a vitamin. That's why we have to look at it independently of a big pharma. Now, just going on looking at this, conclusions. Vitamin D supplement for 5 years, with or without omega-3 fatty acids, reduce the risk of autoimmune disease. So this is effective. Omega-3 fatty acid supplement, with or without vitamin D, did reduce the rate, but it's not statistically significant. So there may be an effect there here, but it didn't show it. Whereas vitamin D, the evidence is there in place. Now, the clinical importance of this is high, because these are cheap. They don't say cheap, but they say well tolerated, non-toxic supplements, and other effective treatments. Really, there aren't that many other effective treatments to reduce the incidence. So we can treat these a bit when we've got them, largely by giving steroids actually to reduce the inflammation, which isn't the ideal treatment, to be quite honest, because steroids have side effects. But in terms of preventing these, we're a bit stuck. So this is remarkably encouraging. Relatively small doses of vitamin D. So just vitamin D supplements. I get these from the supermarket. I mean, I don't want to advertise any particular supermarket, but these are cheap. These are readily affordable vitamin D supplements. Now, with 2,000 units of vitamin D a day, it's probably okay. But the other one that people are often short of, that goes with vitamin D, is vitamin K2. I personally take, well, I don't take vitamin D in summer now, because I get some sun when I'm out digging in the allotment. But the vitamin K2 I take. Now, the reason I take the vitamin K2 is because we don't get many fermented foods. So this comes from bacterial fermentation. So a lot of us are short of the vitamin D because we don't get enough sun. A lot of us are short of vitamin K2 because we don't get foods that are derived from bacterial fermentation, such as grass-fed meat, grass-fed milk, and the sort of food. They eat lots of these foods in Korea and Japan, the fermented foods, but we don't really eat fermented foods. Although on the continent you eat quite a lot of sauerkraut, which is fermented. We do get some from cheese, but not that much. So and the thing is that the vitamin D can mobilise the calcium, and the vitamin K2 puts the calcium away from the tissues into the bone, so it gives you strong teeth and bones, but it stops the calcium from accumulating in the tissues, because of course vitamin D mobilises calcium. But we've talked about that in other videos, but it is a bit of a combination, a bit of a great combination, those two. Now, that's largely what I wanted to say, but I think we'll just mention autoimmune diseases. Rheumatoid arthritis is affecting the joints, of course, terribly debilitating disease. Polymyalgia rheumatica gives very stiff muscles, particularly in the morning. Hashimoto thyroiditis messes up the thyroid gland so you don't get enough thyroxine. Psoriasis is an overproduction of skin cells. Diabetes type 1, patient doesn't produce insulin. Multiple sclerosis, progressive paralysis due to destruction of the myelin around the nerve cells. And these ones particularly, in fact lupus as well, can occur primarily in young people. Now, this study doesn't comment on these young age group onset conditions particularly. It gives us the evidence in the older age group, but it would be surprising if it didn't work for the younger age groups as well. But in research, we can only say what the study actually says. That's all we can be definitive about. Lupus is a systemic lupus erythematosus, which can affect the brain, the heart, the lungs, anywhere. Terrible disease. Inflammatory bowel disease, Crohn's and colitis that people have often heard of. Addison's disease is not enough of the cortisol from the adrenal glands. Graves' disease is overstimulation of the thyroid gland. All these are autoimmune diseases. Myasthenia gravis causes paralysis. Pernicious anemia reduces the oxygen carrying capacity of the blood. Autoimmune vasculitis causes painful blood vessels and disrupts the blood supply to certain areas. And celiac disease is also autoimmune, which of course is the gluten protein intolerance from grains. So inflammatory autoimmune disease responds to self-tissue, so the body's attacking its own tissues. Third leading cause of morbidity in the industrial world. Chronic conditions, they don't go away usually, increases prevalence with age. Lack of effective treatments, and that means that people suffer from these often for decades. Often causing a lot of morbidity and a lot of reduced mobility, for example, which, to be quite vulgar and honest about it, means they're very expensive to look after as well. And that could all be reduced, according to this data, by 22%. What's not to like for vitamin D that costs essentially nothing? Whereas looking after a highly debilitated person is extremely expensive. Of course, that's just looking at it from that point of view. This reduces human pain, suffering and death, which is the real good thing about it. Now, this trial here, the vital randomized controlled trial, now, it's a bit of a, it's VITD. I don't know that's how they got the vital anyway. It's straining a bit much out of the tea bag. But it's vitamin D and omega-3 trial, which is what it's about. Randomized controlled trial based in the States, large numbers, investigating D3 and omega-3 supplementation in the light of reduced risk of developing cancer, heart disease, stroke, as we've seen autoimmune disease in this one, in people with no specific history of these things, which is important. Because if you've had one, if we just take, for example, autoimmune disease, if you've had one autoimmune disease, you're more likely to develop another one. But wouldn't it be nice if we can reduce cancer, heart disease, stroke, which these things may work on, particularly the vitamin D. Consistent with this study, other studies aren't showing that big an effect actually with the omega-3, but we'll wait to more studies because this is a 5-year interventional phase study has gone, and now we're getting the data crunched out, so hopefully we'll see more ongoing data, and as well as that, these patients are being followed up longer term. But so presumably we'll carry on seeing data from this in 5 years. Lots of data coming out this year, but some in 5 years, some in 10 years. Who knows how long they'll be able to keep this trial going for. So there you go. Pretty convincing evidence to take. Dirt cheap, very safe. 2,000 units of vitamin D a day. Personally, I take more in winter. 22% reduction in autoimmune disease. according to this trial. That is what the data says. That's the best we have at the moment, and it's consistent with so many other things, therefore should be rolled out, in my view, by governments as national policy. Pity the UK government, for example, and the US government are not following up on this safe, efficacious treatment. Let's hope they're not doing that to promote expensive pharmaceutical treatments. But if you do look on national guidelines, they do talk an awful lot about drugs, which are needed, of course, sometimes. But of course, prevention, you and me know, prevention is better than cure. Thank you for watching.